go.
Go to sleep about it. I hear you snort.
Every 2 minutes, I went gas.
Scotty Johnson probably from last year. If it's in last year.
I'm gonna walk in front of the camera by accident.
Yeah, start screaming.
Okay.
Hey, like, good.
Here we go.
You're missing. I'm on camera.
All right, legal medical ethics. What do you think? What are ethics?
What's good and what's bad. Knowing what's good and what's bad.
Yeah, it's like the study of your morals. Okay, let's talk about the difference between morals and ethics. Your morals is kind of like what you go by, right? It's kind of like your personal code on what's good or bad. Ethics is really the study of what's good and bad, or what's right and wrong in terms of how you treat people. Why are ethics important in healthcare? Why is that an important part of healthcare?
To give your patients their options.
Okay,
So you don't get sued?
okay, good. Right, you want to make the right decision so you don't get sued. What about for you as a patient? Why would it be important that your physician that has an ethical practice?
Just to make sure that you get the best care possible.
Yeah, definitely, right? You don't, I mean, you trust, you think about all of the trust you have with your doctor or a nurse or whatever healthcare worker. I mean, you're trusting them with your life, you know? You're trusting that they are making the decision that's best for you, and that they're not deliberately killing you, right? So, because they could do that. They could just give you the wrong medicine and say, oh, take 3 of these and you'd be gone. So, yeah, ethics plays a huge role. What are some, and I'm not asking you to debate these right now, okay? But what are some ethical situations that you hear about in healthcare? I say ethical. What are some ethical debates?
When
Let's say
someone's
that.
a vegetable, if you should keep them on life support or not.
Okay, yeah. So sometimes life support, all right.
What about the thing where like the doctor will like kill the patient whenever like the
Assisted
patient?
suicide,
Yeah.
yeah.
Oh.
Euthanasia, That's definitely because it's Oregon that has legalized doctor-assisted suicide.
What is that?
Euthanasia
In Oregon,
in Oregon.
you can choose if you want to die or not for life.
That was a really big, and we'll talk about this in the coming days, but that was a really big case. Have y'all ever heard the term, like, of Dr. Kevorkian? So Dr. Kevorkian is one that he's I don't know if he's a psychiatrist or what kind of physician he was, but he was a doctor, had his doctorate in something. Anyways, and was helping people die. I mean, that's why he got in trouble. The problem was there was a lot of things he wasn't doing. Like he wasn't making sure that they didn't have depression and things like that, you know. Because there are other things that could skew that decision. If you suffered with depression, okay, and you have a terminal, which most people who have terminal illness are going to have some degree of depression, but is the depression the thing that's making them want to kill themselves, or is it that they really can logically think through wanting to, you know, end their life or that terminal, whatever. You know, there's a lot of stickiness in that situation, and that's really what a lot of what ethics boils down to is there's a lot of gray areas as to what's really right and what's really wrong. There's a lot of non-gray areas. I mean, you know, if a doctor purposefully gives you medicine that's going to kill you and that's not what you wanted, that's pretty well black and white, right? They should not be allowed to practice and should have to go to jail for something like that. But, so there's black and white in there, but there's also a lot of gray areas. So that's why we discuss this, because one, if you decide to go into healthcare, it's really important that you know how to make good decisions, right? And know how to make know what's right and what's wrong as far as healthcare is concerned. All right, so terminology first. Civil law, okay, so it focuses on the legal relationship between people and then the protection of their rights. Versus criminal law, okay, is where it focuses on the wrongs against a person, their property, or society as a whole. Okay, so civil, like I said, is relationship oriented. Criminal is like you've done something wrong. Okay, so that's what you're looking at. Like divorces, for example, are usually done in a civil court. It focuses on a relationship. Okay, versus if you like take a baseball bat to somebody's face, okay, that would be a criminal issue. Okay, does that make sense? Okay, a tort. It says torts occur when a person is harmed or injured because a healthcare provider does not meet the established or expected standard of care. We're going to talk about the word standard of care. You'll get that. You're going to do a lot of vocabulary tomorrow. But, okay, as a nurse, okay, there's a certain level of care that I'm expected to perform just because I'm a nurse, because I've been trained to be a nurse. Okay, I know that, I just went blank on any situations now. Okay, if this patient is wearing an armband that says they don't need penicillin and somebody orders methicillin for that patient or whatever, ampicillin or something else, I need to have the wherewithal to know that ampicillin is a derivative of penicillin. If they're allergic to penicillin, they're also going to be allergic to ampicillin. Okay, that's an expected thing that I should know as a nurse. It's not written anywhere. It's not written, it's not like, oh, I can go back and reference that. Actually, that's something I should know. So if I willingly, if they've got on a band that says penicillin and it's been written in their chart, and I give them that medication without checking that, that's neglect on my part as a nurse. That's a tort, especially if they're allergic to it and they went into anaphylactic shock and whatever else they got, any kind of harm that was done to them. Does that make sense? All right, so here's some examples of torts. Malpractice, which is just bad practice, right? You give them an incorrect medication, or it can look like any number of things. Y'all have heard of people getting sued for malpractice. Mm-hmm. Okay, negligence is more kind of like what I was saying, like, you don't look at their allergies, or maybe working somewhere and I didn't go check on a patient for my whole shift and they, died 4 hours into my shift and I didn't even know. Okay, obviously that would be negligence. Assault and battery, that's when you actually put your hands on somebody, right? So you're actually putting your hands on them and there is something that has happened. So, notes on the difference of those two. Okay, I wrote those down. It says assault includes a threat or an attempt to injure. So a threat to injure or an attempt to injure is an assault, right?
Even a threat?
Threat. Well, think, if I'm a nurse, okay, and I go in and I'm like, if you don't stay in this bed, I'm going to give you that medicine, like that penicillin. I'm going to come in here. I mean, yes, I should get in trouble for that, right? So that would be me, okay, and horrible. And I would lose my license and probably go to jail. So that's assault. Battery, it says, includes the unlawful touching of another person. So one example, okay, this says, one example would be surgery or a treatment to minor without some kind of consent, right? You actually perform something on them without the consent to do so. Restraints, so people put restraints on someone who doesn't actually need them, or it hasn't been documented that they need them. And I mean restraints like you tie them down to the bed, or you put them in like a jacket that keeps them from swinging or whatever. Chemical, you can also give them medications to calm them down, and that can also be considered battery. If you give them a medication to calm them down, to restrain them, it's chemical restraint, but you don't have any documentation that says why they needed it, or you didn't have a real reason. Maybe you just didn't like the way they were acting, and so you thought, I'm just going to give them this to calm them down. You can't just do that. There has to be documentation that it was required. So if you did that, that would be battery. Does everybody see the difference in those two? Okay. Informed consent I put on here because that's what you need, right, to do any kind of procedure. It says permission granted voluntarily by a person who is of sound mind.
Colton Early, please report back to your class immediately.
After the procedure, and all risks involved have been explained in terms that they can understand. So when we get into, when you guys take health science 2, we really actually have you guys create your own informed consent for a procedure, and you learn a lot more about it. But basically it's just where they have to sign a document that says they've learned about the treatment, they know what the other options are, they know what's going to happen if they don't get that particular procedure. So let's say I'm going to the dentist and they're going to pull a tooth, okay? They're going to give me a form. They're going to go over with me what are the risks, right? So what are the risks of if they pull the tooth, you know, or I mean, there's a risk of bleeding, there's a risk of infection, whatever. What are the risks if they don't pull the tooth? Maybe infection, yeah, could get infected.
Could push your other teeth.
Yeah, it could cause your other teeth to get infected, lots of pain. What, is there any other options besides pulling it? You know, what are other options? So those are things they have to go over. Invasion of privacy. So it says this includes unnecessarily exposing an individual or revealing their personal information without their consent. So let's say I'm putting in a catheter, okay? And I just leave the door wide open. Okay? No one in their right mind is going to want the whole world to see somebody putting in a catheter. It's not a very graceful procedure. Okay? So that would be an invasion of privacy, right? You expose them to other people who don't need to be in there or whatever. Yeah. Well, you don't have to be. It depends on why you're getting it. But yeah, I mean, I put in lots of catheters in home health. I'm getting dizzy. I put in lots of catheters in home health, and I mean, they were always awake. I didn't knock them out at home. So, but usually if you have a catheter in surgery, which you usually do, they don't put it until you're asleep. So another example, like I said, revealing personal information about them without their consent. So that could be that too. You share their information. Like maybe you walk into a room and the whole family's in there and you give them this horrible diagnosis. Okay? That wasn't meant for the whole family. That's something that they should be able to share on their own time. Does that make sense?
Mm-hmm.
All right, false imprisonment. So that's a restraint issue. Again, you're not giving them the freedom. So battery can fit in underneath that too. Abuse, of course, any kind of care, anything that you do that results physical harm, emotional harm, mental harm, whatever. There's lots of abuse. Physical, verbal, psychological, or sexual. Any of those things can fit into that. And then defamation. Y'all probably heard this word before. Okay, this occurs when false statements either cause a person to be ridiculed or damage their reputation. Okay, this is something people can sue you over. So that's one reason you have to be careful what you put online, because even for a business or something like that can sue you for slander or something. So slander, okay, is spoken defamation, so you say it or announce it out loud. Libel is written defamation, so maybe you write it up, maybe it's online somewhere, or maybe put it in the newspaper or whatever. All right, ethics is the study of right and wrong based on moral law. It says ethics are a set of principles related to what is morally right or wrong. It centers around respect for the needs and rights of other people. Ethics provides guidelines for acceptable behavior. So it's something that you have to constantly work on. Let me go back to this real quick. On this other notes page, it says they're formed through the influence of family, culture, and society. And that makes sense, right? You think, how do you know what's right and wrong? how you grow up, right? What else?
The law.
Okay, the law kind of sets up what's right and wrong for sure. And just because your friend's mama didn't get onto him for stealing when they were little, does that make stealing right? Because they didn't get in trouble for it? No, right? That's a something that we know is against the law. It's against like kind of your standard morals, right? We know it's wrong, whether you learn that or not. Doesn't, just because something is right or is not right for you doesn't mean that it's not right or right for society as a whole either. Okay, codes of ethics related to healthcare delivery don't provide solutions to issues, but serve as guides for ethical and moral conduct. Later this week, you guys are going to look at 2 pledges. You're going to look at the Nightingale Pledge, which is what the pledge that nurses make when they graduate. And you're also going to look at the aristocratic oath, which is what physicians say when they graduate. Is that right? Sounds weird when I say that, but anyway.
It says right there.
Okay, good, thank you. I said aristocratic, Hippocratic. My brain. Yes.
Why the nightingale?
Nightingale is for Florence Nightingale.
Oh, I thought that was like the bird. That's my bird.
Florence Nightingale, the first nurse. Okay, so historical development of the medical code of ethics. So, oh yeah, I said it right there, and I'm just looking at the Hippocrates, who was he?
The father of medicine.
Father of medicine, right, modern medicine. So he basically, some form of this oath is what he came up with. It's kind of hard to understand. So when you look at it on Friday, kind of just pick out what you understand in it, because it's kind of written in old English kind of terms, so it's not really wordy. But you can pick out some things in there you'll understand. So yeah. This one is still used, like I said, and it just talks a lot about not, doing what's best for the patient and not, sharing, like keeping their information confidential. It has kind of some very basic ethical practices in it. The Maimonides prayer says he was a Hebrew physician in Egypt in the 12th century, and he wrote this prayer that incorporates some ethical principles as well. The Nightingale Pledge was formed by a committee at the School of Nursing in Michigan, so it's an oath pledged by nurses, and you'll get to read it Friday. And then the Declaration of Geneva says the Second General Assembly of the World Medical Association in 1948 adopted this. The Statement of Medical Ethics, it's used a lot in a lot of medical schools as well. All right, so Code of Ethics. Primary goal of Code of Ethics says is to promote an optimal level of wellness, preserve life, and then provide for a peaceful death when necessary. Promote an optimal level of wellness. What does that mean?
Best care you can
Do what?
like the best care you can
Yeah,
provide.
right. You want to give them the best care you can give them. Don't you hope when you go to the emergency room that they're giving you the best care they can give you? Right.
If they give you what you could afford, it would be bad.
Yeah, definitely. Okay, preserve life, which means
Keep them alive.
keep them alive, right? We want to, and then provide for a peaceful death when necessary.
Let them go in peace.
Right. You can, in a way that is dignified, right? Sometimes that there's just a fine line between preserving life and letting them die, in a dignified way, and that's a hard balance sometimes when you get to the end of life. Okay, it says the healthcare worker respects the religious beliefs and cultural values of all clients. Okay, it's really important that even if they don't believe the same way that you believe, I'm not saying that you have to believe what they believe with them, but you do have to respect their wishes and respect what they believe. Again, I'm not saying you have to go along with it. Okay, you don't have to, if you're not comfortable whatever. You don't have to go on with it, but you do have to respect it and not expect them to think the same way you do and to act the same way you would. Okay? The healthcare worker provides adequate and continuous care for all clients regardless of age, gender, race, or nature of the illness or injury. Now this sounds like, oh yeah, duh, of course you're not going to treat people differently. But this gets really hard when you're treating someone that you know has done something bad. So, like I've had situations where kids have come in and they have obvious signs of abuse, like physical abuse. I mean, there was obvious that something happened to them and that the parents are lying. It's really hard to have respect for those parents and to treat them the same as everybody else that comes in. But as a healthcare worker, one, it's not like for me as a nurse. Now, if you do forensics or something, it might be different. But for me as a nurse, it's not my job to decide, who's guilty and who's not guilty. It's my job to take care of the patient. So, do I report? Absolutely. You don't ignore it ever. No. But it's not my job. I'm not a judge, right? I can't determine that. So I have to treat them, I ask questions, try to get to answers, but in the end you report it the way that you're supposed to report it and you follow whatever protocol you have to follow. But sometimes it's really hard. I think about, a prisoner, maybe a prisoner comes in to get medical treatment or whatever. And it's really easy it's not really easy. It's just hard sometimes to treat them the same way you treat, your grandmother or somebody else. So. Okay, the healthcare worker knows the limits of practice for which he or she is confident and stays within those limits. Okay, I'm a registered nurse, and I'm just talking about nursing because that's my experience and that's what I am. I'm not saying, obviously, I don't expect all of you to be nurses. Okay, but I know that for me, I can't prescribe medicine. I can't diagnose someone and tell them what they have wrong. I can't look at an x-ray and say, oh yeah, your arm is broken. That's not within my scope of practice. I'm a nurse. I just take care of it. So if the radiologist says their arm is broken, then I can take care of their arm once I get instructions. But I'm not going to tell them because that's not for me to tell. I can't diagnose legally. The healthcare worker maintains confidence and current knowledge by pursuing continuing education. And that's usually required. So any healthcare field you go into, you're usually going to have to do some kind of continuing education. Like for me to keep my nursing license, I have to, every 2 years, I have to do 20 hours of continuing education. I just have to take classes and things that kind of keep up, Healthcare worker practices jurisprudent behavior at all times by avoiding unethical or illegal practices. That means that you do what's safe. That's what they're talking about. If I come across an accident on the road, okay, I'm a nurse. I'm going to provide first aid. I can provide CPR. I can provide some basic, emergency things. I know how to stop someone from bleeding. I know how to, keep their neck still and things like that. But I'm not going to perform surgery on the side of the road. Okay? I'm not a surgeon or a physician. I'm a nurse. Okay? So that would be an example of that. I'm gonna do what's safest for everybody. Sometimes that gets hairy too. But. Okay, the healthcare worker respects the dignity and rights of each client by maintaining confidentiality and a professional attitude regarding all their information. Okay, so that means you're going to find out some things about people that you might not wanted to know, right? Or that might give you an idea into their history or their background. And you got to treat them the same. You respect everybody the same. They're there. For me as a nurse, at least, my job is there to care for them. So whatever your job is, if you're working in the lab, if you're an x-ray tech, you do your job and do it in a way that they can stay dignified. no one ever deserves, I don't care what they've done, they don't deserve to be ridiculed or deserve some kind of undignified care. The healthcare worker asks for clarification and assistance when unsure of any aspect of care. If you don't know how to do something, don't just try it out on somebody and hope that you know what you're doing. Okay? Always be willing to ask for help. And that's important for any job you guys ever do. Okay? Go ask somebody, say, hey, I've never done this procedure before. Would you mind doing it and letting me watch you? Or would you mind standing beside of me and walking me through it? Okay, that's all you have to do. Have a learning. People like to hire people who are teachable. And so that's something to work on, something to practice. And that's a great word to use when you go into interviews someday, is give some examples, I feel like, hey, I'm really flexible. I had to manage, I had to manage 5 patients and blah, 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 whatever. Those are flexibility and teachability. I really like to learn. Consider myself a lifetime learner. I could be like a professional interviewee, I swear. But anyway. The healthcare worker participates in professional activities and organizations, so just keeping your information up to date. Okay. The healthcare worker maintains a high standard of ethical and legal behavior in his or her private life as well as professional life. Okay. I will tell you guys this, and I tell my classes every year. It is so important that you are careful about what you put on social media. And I'm talking all avenues of social media. Because whenever colleges go to see if they want you to be on their campus, they can go to your Facebook and they will do it. Employers can do the same thing. They can use whatever's on your Facebook or whatever's on your Twitter, whatever you're using. Oh, absolutely, and people have. So that's something that you just need to know. Like, that says something about who you are. Okay, if somebody goes to Facebook and they see that you are like complain about every single person in the universe, they're gonna be like, I don't really want a complainer here, right? Or maybe you've made like a whole bunch of political comments on your social media that is just like, just very strongly opinionated, and it's easy to see that you cause disruption. Employers don't want people who cause drama at their work. They just don't want that. So I'm just telling you guys, be careful what you put out there. And it's important. You think about this, okay? Let's say my granddad, we'll say, it's a hypothetical situation, is a patient at ABC Home Health. Okay, and so his nurse is my friend on Facebook. And if I go out and I see where she posted, or he, could be she or he, posted at 2 a.m. about being, drunk all night long, or maybe they posted at 7 a.m. and say, I'm headed to work even though I have a hangover, okay? Do I really want her giving medicine to my granddad while she's got a hangover? No, she's going to be pretty foggy-headed, right? I don't want her filling up his medicine box with 30 different medications for the week if she's not thinking clearly. So, it makes sense. You don't want that. And neither does anybody else. Standards of behavior: confidentiality, accuracy, honesty, dependability, right? Things that are important for the healthcare worker. Confidentiality. Everybody know what that means? Yeah, you're keeping their information confidential. You're not announcing to the world what they did. It doesn't even have to be to the world. Here's an example. Let's say I work on the 3rd floor of the hospital in X-ray, okay? And my aunt is on the 5th floor on the telemetry unit or something. And I just log in and go look at her files. I have broken confidentiality. It doesn't matter that they're in the same hospital. If they're not associated with me as my patient, I can't look at it. It's still a breach of confidentiality. Lassiter read, y'all are going to read about this tomorrow. I'm going to keep going for now. You'll get those 3 words tomorrow in your definitions. Standard of care and scope of practice. So standard of care is the level of performance that's expected from a particular healthcare worker. So that looks different. Well, not really necessarily, but it's a level of performance. So it's just what you're expected to know and do. Like I talked about a while ago with knowing that penicillin and ampicillin are ampicillin derived from penicillin, so they are going to be allergic to both. Okay, that would be something that would be expected from me as a nurse. I wouldn't necessarily expect a certified nurse aide to know that. Okay, but they're not going to be given medicines anyway. So, law of agency. You'll get this tomorrow too, but that just says that your organization is responsible for whatever you do. So if you give a patient the wrong medicine and they decide to sue, they're not just going to sue you, they're going to sue the organization. The organization is as responsible as its workers.
So like the hospital,
Do what?
like the hospital.
Right. Is responsible for its workers that's working under it. So if they make a mistake, it's the hospital's mistake as well. Scope of practice is like what you're able to do based upon your job description. So for me as a nurse, I have a certain things that I can and cannot do. Like I talked about with prescribing medications or diagnosing someone. And I need to know what everybody else can do too. If I've got CNAs working under me, I need to know what's in their scope of practice so I'm not asking them to do something that they shouldn't be doing. I'm not pressuring them to do that. Informed consent, we already talked about this. Adults of sound mind can give, okay, sound mind, keyword there. So if they can't make decisions on their own, or if they're under the influence of something, they're not of sound mind. They can't make up their own decisions. So it has to include the treatment, why it's necessary, what risks there are, if there's any other treatments, the risk of any other treatments, and then what happens if they say no, if they refuse it. Confidentiality, so privileged information, or I think maybe on the quiz next week it says privileged communications. You might write that in there too. It's the same thing. Okay, privileged information is confidential data, and that includes all medical and personal data. So you can't give somebody else their address because you got it at work. That's still privileged information. That's still a breach of confidentiality. Confidentiality is the most long-standing, consistent component in all codes of ethics. So you'll see that everywhere, which is true. You don't want, there's no reason, for other people to know your information. They don't get to do that. Client information can only be discussed with other healthcare providers who are involved in the care. Okay, again, not on the different floor of the hospital, but people who are actually involved in their care. Confidentiality must be maintained in order to preserve human dignity. Everybody understand the word dignity? Right? It's your it's kind of like your preservation of yourself. Right? It's your you're not being ridiculed or embarrassed. It's like your self, I don't want to say worth, but like your ownership of yourself kind of idea. Trust is built between the client and health professional by maintaining confidentiality, and that's true. Confidentiality is an ethical and legal responsibility, unless we're going to be talking about it right now. Patients' ethical and legal right to keep their medical information private is what we term confidentiality. The results can include a civil suit, right, a lawsuit. You can lose your job or lose your entire license to ever practice again. It's a federal offense to breach confidentiality. Major money is involved. So confidentiality can be waived. So you don't have to follow normal confidentiality rules if a third party request a medical exam. So for example, let's say you go to Kimberly Clark and they request a medical exam and they send the information to your doctor. If they're the ones that request it, then they get that information back. Does that make sense? Client sues a physician for malpractice. Okay. Anytime you sue somebody for malpractice, whenever it goes to court, all of that information is going to be put up on this big screen. That's another reason why you want to make sure that you always write everything down. That's what protects you. Or if the client signs a waiver allowing some kind of release. In all states, certain patient information is exempt by law and reports to proper authorities are required without consent. So births and deaths, they're filed with the state. So obviously that information is given. Emergencies, so if there's some kind of emergency where that takes precedence over getting some kind of consent. Injuries caused by violence, because they have to be reported to the police. Not saying that you report them to everyone, but they would have to be reported to the police. Threats of serious bodily harm to another person that you can be reasonably believed. So again, police involvement. Child abuse, any kind of abuse. Vehicular accidents involving drugs or alcohol, that has to be released. Again, police. So a lot of these are, it's not like they're saying, oh, you can go report this to the news. They're just saying it's waived beyond its normal confidentiality. A reportable, communicable, or sexually transmitted disease. There's certain STDs that have to be reported to the state that they keep track of their incidents. If the client is incompetent or incapacitated. So if they can't make their own decisions and you have to contact a family member or someone else to make decisions on their behalf, then that waives their rights. And then asking to commit or hospitalize someone who, like a psychiatric client that needs to be committed into a psych hospital. What else can I, like 2 seconds. Stop it.